100% agree with that paragraph. Here's the issue. For like 2 years, you couldn't be saying that crap. You'd be banned from YouTube, Facebook, Twitter. All the big tech companies would censor you and banish you from their platforms for saying an obvious truth, right? We're considered conspiracy theorists, meaning the left talking about conservatives and Republicans, for saying this exact same thing for 2 years. We said, hey, you know what? Maybe don't shut down the schools anymore. Maybe remove the mask. Maybe remove some of the restrictions in the restaurants. Maybe get things back to normal like Trump was saying. And if you said that, you were just like considered pure evil. But now it's totally okay now. In 2022, it's totally okay to say the obvious, the stuff that we've been saying for 2 years. I just want to highlight it because I just think it's incredible. Welcome to the Bald Brad Show. Our story here is regarding a new study that was just released by the CDC that indicates a steep decline in teen mental health. Now, as always, yes, folks, hit that like and subscribe button. But more importantly, in the comment section down below, let me know how you have all been doing. There's a ton of stuff that's been going on with Biden in office. Heck, you have the immigration crisis, the US-Mexico border, that's only gotten worse. And who could have thought that could have happened? Meaning literally getting worse, where you have over 200,000 people a month being apprehended. You have the debacle going on with Russia and Ukraine. You have Joe Biden fumbling through his words on the world stage with NATO talking about Russia. You have 40-year record inflation, which is causing our gas prices to go up, as well as our grocery bills. So, I mean, there's a ton of stuff, folks, which is why I'm genuinely curious on how you have all been doing. I look forward to reading your comments down below a little bit later today. Well, this comes from Blaze Media. And they say here that this past week, the CDC indicated that American teenagers are experiencing a steep decline in mental health in response to the COVID-19 pandemic and COVID lockdown protocols. And to be quite honest, this isn't really a shock. We all knew this was going to be the outcome, but it is nice to at least have a study here, specifically an observational study that kind of confirms what we already thought. It says here that these data echo a cry for help coming from CDC's acting deputy director in a statement. The COVID-19 pandemic has created traumatic stressors that have the potential to further erode students' mental well-being. And as you notice, I highlighted that word stress, or in other words, stressors, because I think that word does affect maybe the outcome or some of the outcome of the study or observational study. Now, I think it actually inflates the study to make things worse in terms of mental health and teen mental health, and we'll zoom in on that in a moment here. The Washington Post reported that the CDC's new findings draw on a survey of a nationally representative sample of 7,700 teens conducted in the first 6 months of 2021. The survey emphasized collecting data during students' first full pandemic year. Students were questioned on a range of topics that included questions on their mental health, drug use, whether they encountered violence at home or school, and if they encountered racism. Check this out. This is amazing that they get away with this. The study suggested that whereas young people were spared the brunt of the virus, since they were statistically far less likely to fall ill, experience serious symptoms, or die than their older counterparts, they might still pay a steep price for the pandemic. 100% agree with that paragraph. Here's the issue. For like 2 years, you couldn't be saying that crap. You'd be banned from YouTube, Facebook, Twitter. All the big tech companies would censor you and banish you from their platforms for saying an obvious truth, right? We're considered conspiracy theorists, meaning the left talking about conservatives and Republicans, for saying this exact same thing for 2 years. We said, hey, you know what? Maybe don't shut down the schools anymore. Maybe remove the mask. Maybe remove some of the restrictions in the restaurants. Maybe get things back to normal like Trump was saying. And if you said that, you were just like considered pure evil. But now it's totally okay now. In 2022, it's totally okay to say the obvious, the stuff that we've been saying for 2 years. I just want to highlight it because I just think it's incredible. They're just totally okay with saying it now. But they're not wackos. Only we are. It says here, children are displaying negative side effects of coming of age while weathering isolation, uncertainty, economic turmoil, and for many grief, the Washington Post reported, implying there's a biological difference between men and women. This is coming from the head of the CDC's Division of Adolescent and School Health. Said the recently concluded surveys results show male and female students have vastly different results. Oh, I was told there is no differences between male and female. I was told by the left for years. I've been told by these progressives and these celebrities, there's no difference, right? We all want equality. You have Leah Thomas in the swimming thing. There's no difference between that dude and the females that he's competing against. There's no difference. He's just crushing this competition, winning national titles. It's just amazing how much stuff And again, I agree with what they're saying. It's just amazing on how in one thing that agrees with the study, they're willing to show, meaning there's biological difference. But when something goes against their narrative, they're just going to completely ignore it. Truly astonishing here. And again, it's coming from the CDC, and it is coming from the adolescent and school health person, meaning the head of that. Just find it interesting again, folks. The same person reported that female students are far worse off than their male peers. The Washington Post reported that the survey underscored the vulnerability of certain students, including LGBTQ youth, and students who are being treated unfairly because of their race. Now, LGBTQ students already have traditionally an increase or a steep increase or decrease, however you want to describe it, in mental health, meaning that their mental health is disproportionate than the general population. I mean, they're more likely to be sad, they're more likely to commit suicide, all sorts of things like that. So it's going to inflate the numbers once again. I just wanted to highlight that note here because they're not going to. It said that all students were impacted by the pandemic, but not all students were impacted equally. This survey's findings are not the first time medical officials noted their concerns about a growing mental health crisis among America's teenagers. This past October, the American Academy of Pediatrics declared a national emergency in child and adolescent mental health, and said that its members were caring for young people with soaring rates of depression, anxiety, trauma, loneliness, and basically suicidality that will have lasting impacts on them, their families, and their communities. In December, the Surgeon General said the pandemic's era, unfathomable numbers of death, pervasive sense of fear, economic instability, and forced physical distancing from loved ones, friends, and communities have exacerbated the unprecedented stresses young people are already faced or facing. Well, again, this isn't a shock to anybody on the right side of the aisle. We said that this stuff would happen. We said there'd be more abuses at home that wouldn't get reported. We would say that students aren't being fed in the same way because a lot of students have meal plans at their local schools. Somewhere in upwards of in LA County, like 50% or more of the students there are eating for free. That's how they get their lunch and food. So we knew that these numbers would be terrible. We knew that these effects would happen because of these lockdowns, but the left didn't want to listen to us, right? The progressive left, the celebrities, right? These Democrats did not want to open things back up. They kept things locked down. Then you had the media side of it. MSNBC, CNN, these leftist news sites were invoking fear. Charlie Chester, the CNN technical director, talked about this on camera with Project Veritas, coming out and saying that fear sells, that this is a big thing, right? And so it only exacerbated the problem. Now, one thing I want to zoom in again on the aspect of stress or stressors. So what's happening, at least from what I've seen in the school system, is that anytime a kid is under any sort of stress, it's a mental health problem. So for example, all of you have taken exams in school. Yeah, you're going to be a little bit stressed out about it. Who wouldn't be? You're being questioned and you're given a letter grade and a certain outcome based on what you know. So if you didn't study, if you didn't put in the time to know the material, of course you're going to be stressed out. Who wouldn't be? Heck, I'm stressed just giving the thing to you because I know you didn't study. You know what I mean? As the teacher. But you don't see me not showing up to class, right? So anytime there's a test being given and a student is stressed out, what they can do in some scenarios is they can sit in the counselor's office or the school psychologist office, depending on what the school site has and what their services is that they offer, can sit in there and not take the exam. Or sometimes they're given a whole separate room and they could take the exam in there at a later date than the general population, meaning they get more time to study, they get more help from other people, all sorts of stuff, meaning it creates a disparity in that outcome. But again, the left doesn't want to talk about that. Just as long as you have a mental health, which I'm not diminishing. I think mental health is very, very important. It is not something I play with in the classroom. So if a student is experiencing mental health, I offer them all the services that I have, as well as the school site, the district, or whatever. So if a student is saying they're stressed and it's causing mental health, I do take it serious. All I'm bringing up about this is the amount of people that are utilizing mental health as a reason to not take an exam or show up to school or something is unbelievably inflated, meaning it's everybody that's using that excuse. And I've heard students even say, hey, I've heard people literally using this as an excuse. Multiple people just not take a quiz or exam or show up to school or not show up to some sort of academic thing that's required of them. So it is 100% students using it as an excuse. And I think we could do a lot better as parents, as educators, and as adults to kind of push our students a little bit more or push our teenagers a little bit more in getting them to finish whatever it is they need to finish. And that's what we're here for. We're here to gauge and see where they're at. But that's not what the school system is necessarily doing. if anything, they're kind of hindering students from progressing. If anything, they're kind of nurturing that idea of mental health. I mean, how many times have we talked about the transgender movement taking place here, where it's considered normal to think you're a female when in fact you're a biological male? And they're going to sit there and support you through that. They're even going to try and push the transgender surgeries upon you. We just saw that in the other episode where the Biden administration, the White House, came out with a press release and a statement that showed a graph that said they're all for adolescents getting sex changes, same-sex changes, meaning literally getting your thing cut off and implanting boobs in you and giving you puberty blockers and hormones that increases whether it's testosterone or estrogen. This stuff is nuts. So no wonder there's a massive problem going on with mental health, because on one side, you have the left that's exacerbating the problem through the media, through the stuff the White House is pushing, through these surgeries, through on-school site psychologists and counselors. And then on the other end, you have the other side, the right side, being understanding of the situation that, hey, there's mental health. We need to be careful of it. Of course, we don't want anybody to hurt themselves or do anything silly, because we love them. We love life. A lot of us are Christians, Catholics, or some sort of religion that follows some sort of faith. And we want to take it serious, but at the same time, we know that we need to sit there, yes, support the child, support the person, but also push them along. That way, just because you're stressed does not mean you just get out of things, right? Heck, you say that to your boss, oh, I'm sorry, I'm a little stressed out from work. I'm not going to show up today. Forget it. Like, yeah, you can call in sick or something, but you're still required to show up on the job or you quit. So there's a whole problem with this on these numbers technically being inflated here, especially questioning LGBTQ child or children. Of course, the numbers are going to be inflated. Utilizing the word stress, it's going to be inflated. Even the question on racism is quite interesting here, because that is purely subjective. Somebody could take another person's comment as racist when in actuality it isn't racist. I mean, I know kids that will say something that has nothing to do with race, literally nothing to do with race. They go, oh, that's racist. It's like, I don't think you mean racist. You know what I mean? I think you mean another word you're just utilizing as racist. So when we're questioning teenagers, we need to understand that through an observational study, there's a lot of biases that could seep in, from response bias, non-response bias, meaning they only sampled 7,700 kids. Non-response is you trying to reach out to children or kids or teens that haven't answered the survey, that would have answered differently, that would have affected the survey. Response bias is a student just telling you things you wanted to hear. I mean, there's a litany, again, of biases, and that's kind of the problem that you run into with observational studies. Whereas in design experiments, you can create a cause and effect. You can create an experiment that limits lurking variables and confounding variables and biases, where again, in observational studies, you can't. So you kind of take this study as a grain of salt in some way, shape, or form. I do believe the outcome, just because that's what we would expect to happen based on these lockdown and these protocols. But you got to love, again, folks, the left getting away with all these truths that they're throwing in here through the CDC report. But for years we were silenced and we couldn't say it, but all of a sudden it's okay. Well, with that being said, folks, thank you so much for supporting the Bald Brad Show. Please don't forget to hit that like and subscribe button. Share with your friends and family all over social media. And again, please, folks, don't forget, let me know how you're doing in the comment section down below. We got to show love to one another, and I really care and love for all of you. You do support me, and I want to look at us as friends and as a family. With that being said, thank you so much, and I will see you later today here on the Bald Brad Show.